all of a sudden the mass emphasis, and how are we going to get our arms around it and make it digestible, I guess?
Yeah, so one of my concerns is it has been around for years. WHO, the World Health Organization, has talked about social determinants for many, many years. And we know on a macro level that if you look at populations and you determine how they fit into these 11 domains of social determinants of health, you can show evidence that people do better when they're in certain categories and worse when they're in certain categories. But now we're asking primary care physicians or point of care clinicians to capture these 11 domains in a more formalized way, because we want to be able to do the data dives, and we're burying the people who are already buried. So my concern is it's a great catchphrase. Everyone talks about it. It's kind of like population health has been. We love to talk about it. There's a whole bunch of people making money talking about it, but no one's really solving it. I think the American Academy of Family Practice has probably done the best job in determining how do we get it into the workflow and creating a conceptual framework for how we bring it into the workflow. But my personal opinion is that the data gathering is going to have to be through a patient-facing interface, registration process, much like they do for their pre-visit registration in MyChart or other patient portals. And then we have a chance of using background diagnostics, background analytics to present opportunities to the care team at the point of care. But if we expect it to be done by the care team and created by the care team, it's not going to happen. We're basically asking people to do what the Census Bureau cannot even do. We do a sampling as the Census Bureau, and now we're turning to the care team and we're saying, do 100%. Do every single patient who comes in, every single American, every single person seeking care in these areas that are really Census Bureau type data.
Right.
How do we make that work better? The AAFP, I think, is on the right track. But we don't even have research that shows that on a microcosm level, we can impact health by knowing these social determinants. We know it on a macro, we don't on a micro.